Class, hello and welcome to this advanced practice in health and social care session on communication. I will be your tutor, Big Owl. Today we're going to look at verbal communication, written communication, sign language. Let's first look at why communication is important. Communication is important because when we communicate, we impart information to other people. This helps individuals to be more effective during an interaction of question and answer, where both parties will begin to understand what information is being shared. This also assists in clarifying any misunderstood points, where both individuals can be clear on an objective. Communication is important for health and social care professionals in establishing working relationships with clients. Communication includes verbal communication, that is, spoken, oral, written, and non-verbal communication, which is frequently used to support verbal communication. This section will explore the different types of verbal and non-verbal communication, the effectiveness of communication skills which are relevant to specific individuals and client groups. It will also look at the difficulties that impact on the effectiveness of communication. Let's first look at verbal communication. Face-to-face or oral communication involves using words and sentences, verbal communication. Speaking or signing is central to establishing relationships between people, such as health and social care professionals, with clients, care users. For instance, these professionals need to be able to communicate effectively and be equipped with the appropriate social skills in order to identify the wide range of emotional needs that services users will have.
What about sign language?
Language can be defined as verbal communication. Verbal means using words. Language can be identified as being used not just verbally, through speech, but also by sign language, such as the use of British Sign Language or Makaton. Here, different signs have different meanings, where the gestures translate into words and speech. Smithson, 2005. British Sign Language, BSL, is the sign language used in the United Kingdom and is the first or preferred language of deaf people in the UK. The number of signers has been put at between 30,000 and 70,000. Many thousands of people who are not deaf also use BSL in order to facilitate communication with deaf relatives or the wider deaf community. Sign language involves the movement of the hands, face, and body. The British Deaf Association campaign for the right of deaf people to be educated in BSL and to access information services using BSL. The use of the capital D in deaf is deliberate. It denotes culturally deaf. Culturally deaf means that deafness is about belonging to a different language community and not about being an impaired hearing person. Makaton. The foundations of Makaton come from a research project which identified words that are used frequently and in everyday conversation. This was then matched with signs from the British Sign Language used by the deaf community in the UK, so that as you speak, you sign and speak at the same time. Signs are often pictorial and convey the meaning more easily than words, which are more abstract. Makaton has been recognized to help with speech development, which has helped many children. Makaton is an internationally recognized communication program used in more than 40 countries worldwide. Makaton is used by children and adults and also by friends, relatives, and professionals to facilitate communication. Braille. Braille enables language to be translated into written form for the blind. This means Braille is a worldwide standard used in languages all over the world. Braille uses a system of raised dots which allows people to read by feeling with their fingertips. The Braille code is used to represent words and numbers, plus other characters such as punctuation, mathematical and scientific symbols, computer languages, and music. Braille can be used to label items such as DVDs, CDs, medicine, and there are also now self-study courses available from the Royal National Institute for the Blind. A blind or visually impaired individual will not be able to interpret body language and will rely on what they hear to interpret messages, emotions, and feelings. This can be achieved by using different tones of voice, the speed that you speak, and the pitch. The use of words and phrases are important as they can also describe how you are feeling to a visually impaired person. Touch is also important, and many people who are visually impaired sometimes like to be able to feel a face to gain a better understanding of a person's features. To be able to do this, it is important that the client and professional are comfortable being touched, and consent needs to be confirmed before communicating in this manner.
Is one form of communication better than another? Would written communication be better than verbal communication?
Written records can provide more accurate and permanent forms of communication. For example, it is important for professionals in different health and social care settings to record a client's personal information. This can include a client's medical history, social circumstances, and previous involvement from different services. It is important that information is recorded accurately and conveys the facts. Factual recordings are especially important when recording a significant event or an incident. Professionals should ensure that their personal opinion or feelings towards a particular client are not recorded. For example, a care worker may record how they perceive a client to be feeling when visiting them at home. The client may be looking sad, head hung low. The care worker may write that Mr. X appeared to be sad, but will need to explain why and describe why their physical attributes may form this conclusion for the care worker. It is important that the care worker also acknowledges any other differences, such as in their social presentation, if there are any cultural differences or language barriers that may impact on the client's appearance or presentation. Many organizations use printed forms to help employees, such as for care workers to record information. Printed forms can be used to help staff to ask important questions which may be needed to help complete assessments or record personal details. It is important to remember, though, that there will be times when you work with clients who struggle with written communication, so this may not be the best way to communicate with a client. To summarize what we have learned today, we have looked at what is meant by communication, verbal communication, written communication, sign language. Goodbye, class, and good luck.